Sindura. You know me through Sri Kari Ayurvedic Education Center. I'm glad that you're following all the video series of pregnancy care through Ayurveda. Today's topic is about anemia in pregnancy. Because of increasing nutritional needs of the fetus, the plasma of a pregnant woman is increased by 40%. Because of this increase in plasma levels of a pregnant woman, the RBC concentration in the plasma or the blood is decreased. Because of this decrease in RBC concentration, there is physiological anemia in pregnant women. Every woman all over the world will have some sort of physiological anemia in pregnancy. If this physiological anemia is left untreated, then it turns out to be pathological anemia. Whenever we speak about anemia, the nutritional aspect of anemia is also more important. The key components which play an important role in dealing with anemia are, as everybody knows, iron, B12 and folic acid. B12 is nothing but cyanocobalamin. When we observe the metabolism of these three components, all the three get absorbed in the small intestine. The iron gets absorbed at the level of duodenum. The B12 or cyanocobalamin gets absorbed at the last part of the ileum, and folic acid gets absorbed at jejunum. So, considering all these points, maintaining the health of the gut is much more important when dealing with anemia. Apart from this, small mineral like copper also plays an important role. It acts as a catalyst in treating iron deficiency anemia. This iron absorption or its transport in the body or its levels in the body are maintained by hepcidin, which is released from the liver. Also, B12's absorption is based on intrinsic factor which is released from the parietal cells of the stomach. Also, the folic acid absorption is based on levels of B12 in the body. So, all these three things are interconnected, and most of these three are absorbed in the small intestine. So, maintaining the health of the small intestine or the gut is more important for its proper absorption. Always, digestion has 4 phases. Whenever we consume food, the digestion of the food is important. After that, absorption of that food is important. After that, assimilation of that food at cellular level is also important, and after that, the unwanted material should be excreted or eliminated properly. Now we are going to display a slide which gives you all the foods which are rich in iron, cyanocobalamin and folic acid. Please note down the list of these foods and consume them regularly.
Iron-rich foods include beetroot, poha, dry fruits, green leafy vegetables, mint leaves and raisins, watermelon, poppy seeds, almonds, sesame seeds, bajra, and cooking in cast iron pans also improves iron. Folic acid-rich foods are beans, citrus fruits, green leafy vegetables, eggs. Vitamin B12 rich foods include dairy products, that is milk, cheese, paneer, curd and also lean meat.
Now I'll say you a brief note on B12 absorption in vegetarians. All of we have a myth that B12 is not available in the vegetarian sources, and it is not properly available for the vegetarians. The fact is that B12 is available in all the dairy products like milk, curd and cheese and paneer things. Apart from these dairy products and the vegetarian foods, in the process of evolution, the human being and his gut has some commensal bacteria. These bacteria are able to produce B12 in sufficient amount which is required for the body. This commensal bacteria or healthy flora are present in the gut. That is the reason why I always say that treating anemia is not with iron tablets or B complex tablets or something else, but it is with maintaining the integrity of the gut, maintaining the health of the gut and healing the gut. If you don't have that healthy flora in your gut, your B12 levels are not going to get rectified if you are a vegetarian, and you will ultimately land up in anemia. So what are the things which promote the growth of this healthy flora or commensal bacteria in the gut of an individual are
Commensal bacteria rich foods include curd, idli and dosa batters which are fermented, and pickles.
all these things will have some sort of healthy flora. When we consume them, they land up in particular places in the small intestine and produce B12 in the intestine, which is ultimately absorbed by the body and rectifies all the vegetarian or non-vegetarians from the B12 deficiency. Coming to the Ayurvedic aspect of a Pandu in a pregnant woman, there is a statement or there is a principle in Ayurveda which says that the dosha samorchana of any other disease remains the same for pregnant women and all the other individuals. So, also the pregnant woman with Pandu will also have same dosha samorchana, and the treatment principle is also the same, which is explained in Panduroga Chikitsa. So coming to that, also in pregnant women, the Panduroga is Pitta predominant. So there is Amlakamitva, and the aggravated Pitta accelerated by Vata and Kapha and ultimately lands up in Panduroga. We have types of Panduroga: Vataja, Pittaja, Kaphaja, Sannipataja and Mrudbhakshanajanya. Vataja Pandu is anemia in a pregnant woman with more or less musculoskeletal complaints. Pittaja Pandu in a pregnant woman is anemia in pregnant women with more or less gastrointestinal complaints. And Kaphaja Pandu in pregnant women is like anemia in pregnant women with more or less respiratory complaints like Kasa and Spasa. The Sannipataja will have all these three categories, and the Mrudbhakshanajanya Pandu can be considered as Paika in pregnant women. Some of the pregnant women will have unusual food cravings which can be considered as Paika, and it can be correlated with Mrudbhakshanajanya Pandu. Now I am going to explain you the Ayurvedic line of treatment in combating this anemia. There are a lot of drugs given in Ayurveda like Punnanavad Mandur, Dhatri Loha, Navayasa Loha, Dhadimadigrita, Drakshagrita, etc. There are n number of preparations which deal with treating this anemia in pregnant women also. All these drugs have an innate scientificity which give us a lot of scope for using these drugs in anemia. Every single drug which is an herbo-mineral preparation, that is, which is included with either Loha Basma, that is iron, or Mandura, which is again iron. All these metals are made into a form which is absorbable by the body and added with drugs like Triphala and Tricatu and n number of other drugs. The other drugs which are added with this metals will always have an impact on the gut. This is the scientificity or authenticity of Ayurvedic medicines which work in anemia. Whenever these herbs are added to the iron compounds or copper compounds, they become easily absorbed in the gut. They maintain the gut integrity. Then the acharyas are not worried about whether it has B12 or whether it has copper or whether it has vitamin C, like that, but they have an innate knowledge which clearly indicates that they have given all this list of drugs which are added with metals have definitely an impact on the gut bacteria and heal the gut and aid in the proper absorption of this metallic preparations or iron compounds in the body. For example, in Dhatri Loha, the Dhatri or the Amla have lots of vitamin C which helps in proper absorption of this iron at cellular level. Also, the other drugs like Dadimadigrita, which do not have B12 or iron or nothing, but they aid in absorption of this vitamins and iron compounds from the food we take. Whenever a pregnant woman is loaded with lots of B complex tablets or folic acid tablets or iron tablets, it's not at all going to help if her gut is not clean. So heal your gut properly. You rely on the Ayurvedic drugs which help you in combating this anemia, and stay happy, stay home. Thank you.